this effleurage technique. So all the way up to the shoulder, easing off as we come around the back of the arm. Got any pressure on at the moment, just getting a little bit of heat in there. Okay, and then reinforce, a little bit more pressure now. Stop moving around. Try and sit still. And then just a little bit more pressure.
If you're doing this with a lady,
yeah,
and she's obviously wearing a bra,
yeah,
You need that off. Or
so how do you approach that?
can you take your bra off, please?
Okay. Do you just take and then just lay it?
Don't do it.
No,
Don't
not
do
do
it.
it, but yeah.
Yeah,
I'm just going to leave the room. You can take it away.
yeah. Two ways you can do it. So, if you've got a therapy room,
Yeah.
just say, can you get yourself underneath the towel and take
Okay.
off your clothing? Or in the environment that we're going to be in today, what I'd probably do is women just turn your tables facing out, and then just get the towel and just hold it up like that, so they can pop any t-shirts and undo bras and stuff like that.
Okay.
Will you just demonstrate how to take your bra off?
Yeah. I've only done that one.
Just so if you didn't know.
Yeah.
Okay, so warming them up, effleurage technique, big strokes all the way around, pushing towards the heart. Okay, and then with our petrissage technique, you tend to come around the other side. You can either just work that one side, or you can do the whole body. So big strokes again, just lifting and pulling over. Or we can just do one side. Again, watching that posture. Just hooking in from the side of the stomach, up towards the shoulder. Just working back and down. Okay? Easy. Nice and easy. The other technique you can do on the back is almost a kneading technique. So just side to side. Again, similar to your effleurage technique, just warming the muscle up. It just breaks up any deep tissue work that you're doing. Okay? So effleurage, working in that big stroking area. Make sure you work into around the back of the lats as well, so into here. Okay. So you connect this connective tissue work. We're going to start around the lower back. We're going to work up the spine, and I'll show you around the shoulder, and then some work on the traps as well, just to open them. Okay. So two techniques. You can either use your thumb, or you can use your fingers like we were doing in the glutes. Okay. So just around the lower back, around the SI joint. So fingertips in, I'm just pushing down and away. How's that pressure, Nathan?
Yeah, it's fine.
It's a nice slow technique. Just pulling it off the bone. You can use your thumbs. Just trying to open up that lower back. Okay, so either with the fingers reinforced, or you can use your thumb over thumb, or just use your thumb tucked in like that. Okay, whatever feels more comfortable. With the spine, if you're going to use your thumbs, you're going to stay on the same side, and all I would do is work up the spine, and in short movement, just pull the spine away. So in between the muscle, the bone, just working all the way through to the top. Okay. We can come round to the other side, use the same technique with the 3 fingers. This time we're going to come down from an angle, push in just off the spine, and then push it down and away. And just be careful as you come along this muscle here, not to go right over it. Okay, so just a short movement in between the muscle and the spine, because it feels uncomfortable if you keep doing that over the muscle. Okay, a really short movement. You can see how much pressure I've got in there already. Just trying to break that away, any of those sticky adhesions. And I'll probably work up into around the shoulders, so quite high up. So all the way from there, all the way down the spine. Okay, 2 or 3 passes up and down, and then just mix it together with a little bit of effleurage, just to flush any toxins that you've released. And then you can move into the shoulder. Okay. Everyone happy with the lower back? Yeah. So nice and easy, thumbs or fingers and along the spine. Okay. For the shoulder, you're going to follow the same sort of route that you've been doing your palpation on. So we're going to work just from the outside and then work around the shoulder blades, so around the medial border, round to the spinal scapula, and then just off to the side, okay? You can do this by popping the hand up the lower back if you want to get that shoulder blade out a bit more, or if they're comfortable enough, just keep the hand down, or even just by the side, like that, okay? Wherever's comfortable for them, okay? So all I'm going to do is start just underneath here, with my fingers reinforced, and just nice and slowly, just working around that shoulder blade. And as I get to that top corner, that superior angle, I'm just going to hook my fingertips in, and then pull down towards the shoulder. Back in, push round, and then hook my fingers in and pull down. Okay, again, you can use your thumbs if you want to, if you've got a little bit more control. Okay, this is where you're going to start getting all those knots. Okay, so just take it nice and slow as you're working around here, because if you start going over knots like this, it's really gristly there. It's uncomfortable if you're going fast and you start going over stuff like that, okay? So you just take it slow. And as you get to points like that, where it starts to get really built up, here where I'm going right underneath his traps, just take your time to push the muscle away, otherwise it's going to drop real quick, okay? So just keep it smooth and slow, keep the pressure consistent, and then work all the way around, okay? So you can go both directions from this side, and you can work that side. With your connective tissue, because you're not forcing that much blood flow, doesn't have to be towards the heart. Okay, you can go this way as well. But you can see the pressure I've got in there just from a couple of passes. Okay? If you pop the hand up the back, you can get into it with your thumbs a little bit more, and I can push in sideways, like that, and just get right underneath the scapula. You see here all these knots are starting to build up. Stop moving. Just work around and down. Okay, so both directions. For the shoulder and the traps, all I would do is bring his hand down by his side. Two ways you can do it, either from the top here, hook right at the front of the trap, so into here, both hands over, lift, pull it down the back. So just trying to lift the muscle up and then drag my fingers down the back. We can go from the side, so pull off to the side. Just trying to lengthen that muscle out. Or we can go from here, use the heel of our hand and push out that way. Okay, again, just trying to get as much length into the muscle as we can. Trying to stretch and open them out. Okay? Everyone happy with all those? Okay, there's a couple of ones I'll show you later when we turn them over, but they're just extra ones around the neck and stuff like that, and a little bit more on the traps, okay? So around the shoulder blade, fingertips in, using the thumbs, and then around the traps, lifting it up and over, or dragging it down out to the outside.
Is that petrissage or is that deep tissue?
It's still effleurage technique to an extent. Yeah, you're still stretching the muscle. Yeah, it's not really a petrissage as such. Not really, no. They're just manipulative techniques where you're just trying to get a bit more stretch into the muscle. Okay. Everyone happy with all those? Okay. So they're the main techniques you're going to do on the back. We'll show you some extra ones later for the neck, but they're not part of your assessment. Okay. They're the main ones we need to see on the back. Tapotement is still the same, so practice your tapotement on the back. Again, mine areas where there's build up of bone, so you're not striking too hard. Cupping, hacking, tapping, using your fists, okay, to finish the massage up. And you can also use your friction techniques in and around the shoulder blades here, where you start to get that real build up of gristle and knots, especially like that.